Why endocrinologists should treat GDM? So this is a very interesting question. In fact, the majority of the patients that I have with gestational diabetes are actually referred by my gynecology colleagues. So what happens is that in peripheral areas where there are not many endocrinologists are available, the gestational diabetes is managed by the gynecologists themselves. So there is a key difference actually. So gynecologists are actually trained for securing normal delivery, cesarean section, and they are surgeons basically. And endocrinologists are actually physicians who have been trained in management of diabetes. So in simple cases of gestational diabetes, say somebody who's taking metformin and the blood glucose is well controlled, a gynecologist can also manage the blood glucose of the patient very well. But then what happens is that when the patient progresses, so between 24 and 28 weeks of life is when of gestational age is when the gestational diabetes is diagnosed. From that time, the gestational diabetes progresses by the time the patient is 37-38 weeks of gestation. Between this 6 to 10 week period, when the blood glucose rapidly progresses, the patient may end up requiring insulin, and insulin initiation is best done by an endocrinologist because they are experts at managing insulin therapy. So very often, though the diabetes is not extremely bad for the mother, it does require insulin therapy 3 to 4 times a day using a basal bolus therapy, and this is best achieved by your endocrinologist rather than your gynecologist. And very often in big cities where endocrinologists are available, the gynecologist will usually refer the patient to an endocrinologist for managing your gestational diabetes.